Thanks, Acting Speaker. That caught me by surprise. So, anyway. So, Acting Speaker. Yeah, that's all right. Look, it's a pleasure to rise to speak in support of the Health Legislation Amendment Bill 2026. And the first thing I want to start with is I just want to extend my thanks and appreciation to all the healthcare workers right across the system, including our paramedics and our non-emergency patient transport officers, but all of those healthcare workers, everyone on the front line and in the back of house to keep the system going and to support our patients across the state and to make sure that their health and welfare is well supported. Of course, at a first glance, this legislation like this can appear quite technical, which it is, and it deals with registration schemes, regulatory powers, licensing arrangements, and of course amendments to several different acts. But behind every one of those technical amendments is something much more important, of course, and this bill is about protecting Victorians and protecting their health and welfare. So that's what it's fundamentally about. And it's about making sure that families can have confidence in our health services that they rely on and that public health risks are properly managed before they become emergencies and that our regulatory system keeps pace with our modern healthcare. Of course, these are the kinds of reforms that usually attract headlines, and in many ways the best outcome is that most Victorians never notice them, which is great. When they just take it for granted that things are put in place and regulated appropriately. The legislation strengthens the safeguards that protect Victorian families, of course, and it reinforces the confidence in assisted reproductive treatment. And we've had many contributions about that and some of the issues that did happen, and I'll go to that later. But yeah, so and it also improves the management of the public health risk, and it ensures that radioactive materials are handled safely throughout their life cycles. So dangerous bacteria will be prevented from spreading through poorly managed cooling towers. Radioactive material will be safely disposed of before it poses a risk to workers, patients or the broader community, and that is what is good government, and that's what it should be about, and that's what we need to do about protecting our community and our people of Victoria. And it's also about protecting or preventing harm before it actually occurs. Look, as someone who did spend many years working in the health sector as a paramedic before entering this place, I've seen firsthand what happens with people's experience through illness and injury. And people often think that paramedics is responding to emergencies, but what many don't appreciate is that emergency medicine is only one part of the health system. And behind every ambulance crew are countless people working every day to stop emergencies from occurring in the first place. And that's the whole idea, is preventing those sort of things through the public health professionals that are involved, the regulators that are involved, the inspectors, the scientists, the administrators play a very important part in providing a great system and preventing and reducing the potential of emergencies. And let's not get it to that extreme, hopefully. Of course, they're the people who rarely receive any recognition because they're doing their jobs and behind the scenes in a lot of cases. And as I say, as a community, we take that for granted in what they do. And it prevents outbreaks. It's improving the system all the time and looking to improve the system all the time. No family experiencing unnecessary trauma because appropriate safeguards were already in place, and that's important. That's to provide that sort of support. The legislation strengthens the systems working quietly in the background to keep Victorians safe every day, and again, to prevent any potential extremes such as an emergency situation. One of the most significant aspects of this bill relates to assisted reproductive treatment, and many contributions have spoken about that. And starting a family is one of life's most important journeys. Of course, for many Victorians, assisted reproductive treatment is not simply another health service. It represents great hope for some families, and obviously it's quite an emotional process and a trying process on families. But those families place enormous trust in fertility specialists and clinics, and they deserve absolute confidence that they will be well supported and well provided for through hopefully the expertise in that process. And that's why those services are being delivered safely and ethically and to the highest professional standards. And of course, there's been wide consultation in regard to this bill, in particular with the private IVF sector, and that consultation will continue to go on through implementation. So I think there was some suggestion earlier from some of the opposite speakers saying that there's been little consultation. I'm not so sure that that's accurate. It appears that there's been extensive consultation, and that will continue. And as I say, and I'll make reference in particular to the private IVF sector being included in that consultation, so it's really important. Of course, unfortunately, we saw some recent failures within parts of the IVF sector, and that understandably shook public confidence. And families who had already experienced enormous emotional stress were confronted with failures that should never have occurred. But again, that's another reason why this bill has been put in place, and I commend the Minister that brought this bill forward and thank them for it. Of course, those incidents highlighted that the importance of having strong, independent oversight, and this bill responds directly to those concerns of having good, strong oversight of this process. Of course, following the National Rapid Review of Assisted Reproductive Technology and IVF Regulation, Victoria is taking action to ensure our legislation is ready to implement stronger national accreditation standards. And again, I go back to the point that was raised earlier about the duplication. So this will fall in line with that national review and what comes out of that. So there won't be two bits of legislation. But importantly, these reforms separate government registration from industry accreditation. And that means that registration decisions can be made independently by the Department of Health based on appropriate assessment of governance, compliance history and risk. And of course, the Secretary will have stronger powers to grant, refuse, vary or renew registrations. And the Minister will also have the ability, where appropriate, to cancel a provider's registration. So that's really important. There will be inspection powers will also be strengthened to ensure compliance can be properly monitored, and they're very sensible reforms, and they improve the accountability, and that's what's really important. And of course, it strengthens the transparency of the whole thing. And most importantly, it helps restore the confidence for Victorian families who deserve nothing less than the highest standards of care. And again, any stress and duress that people could have had and caused through some errors made from the past. The bill also makes important changes to the Public Health and Wellbeing Act relating to the cooling towers, and again previously raised in other contributions. Most Victorians probably never think about cooling towers. We just take them for granted too. And I know there were some issues about figures quoted before about suggesting that there were 6,000 and there's only 3,000. I wouldn't have a clue how many cooling towers there are throughout the course of the state. I didn't know we had cooling towers on farms, as the member for South West Coast said, but apparently we have cooling towers at dairy farms to cool the milk. I wasn't aware of that, so you learn something every day. So I have no idea how the total number of cooling towers we have, but again, this bill goes to relating to the cooling towers. Of course, we know that poorly maintained cooling towers can become breeding grounds for Legionella bacteria, which can cause Legionnaire's disease. And of course, that's a serious and potentially fatal form of pneumonia. And as we know, we've seen outbreaks of that in different parts of the state at different times, and interstate too. But and the damage that can cause to individuals and severe cases of pneumonia. Of course, again, in my former life as a paramedic, I know that by the time someone requires emergency treatment, sometimes it's really hard and it can fail. This is a really important bill. There's been some great contributions today, and I commend this bill to the House.
Member for Shepparton.